Welcome to episode 80 of Leaders in Healthcare. Today, we're catching up with Jason Morehouse, founder of HiBoop, a digital platform designed to streamline the diagnosis and management of mental health conditions. We've all been there, short appointments where complex symptoms feel impossible to unpack. Jason himself faced immense personal challenges for many years before his care team was able to fully decipher a complex, multi-morbid psychiatric picture, an experience that inspired HiBoop. It's a tool that helps clinicians see the wider lens of patient care before they even walk into the office. Using more than 50 validated scales like the GAD-7 and PHQ-9, HiBoop employs a unique blinded format. Patients don't know which section they're in, ensuring unbiased results. If the tool detects hints of a specific cluster of symptoms, it subtly pivots, guiding the patient into deeper, relevant screening. For providers, it's a game changer. You get a digital dashboard to track progress, automate routine follow-ups via SMS nudges, and capable of generating the heavy-duty reporting needed for research, grants, and funding. For patients, it's quick to set up and seamless to pause and restart. Discover how to expedite your measurement-based care at hiboop.com. Now, let's jump into the episode.
Today we're talking to Jason Morehouse for the second time on the evolution of HiBoop. How you doing?
Good. I'm here for season 2.
Season 2. For everyone who hasn't actually heard of HiBoop or they missed that last episode, give us the overview. What is the HiBoop platform?
Yeah, so HiBoop is a measurement-based platform specifically for mental health care providers to expedite assessments and make care quicker. So we're a couple of years old now, so what we try to do is help care providers, could be doctors, clinicians, therapists, whatever it might be, expedite measurement-based care to start to run the psychometrics, ideally before somebody arrives at the doctor's office, but that's not always possible, to give a pretty comprehensive profile. We do the assessment, and what we've found is that we've been able to identify things that might not have been identified for some individual. So we provide a full dashboard for the care providers to look and then track progress.
Helping people get clear ideas on exactly how many conditions are we dealing with, what are the different scores, how are we following up on these things. And that was really where the whole platform evolved out of, was that, okay, this is often very multimodal. How do we start to unmuck the waters?
We start by certainly working with the most progressive care providers who also understand that maybe things could work a little better. So if you got somebody who's come in, it was like me, if we go back those 2 years, it was just anxiety, crippling. And I'd have 7 minutes with the doctor and we'd try something else and he'd say I don't know, go jogging or something. After a lot of time of my own investment and self-advocating, yeah, there was more there. There's ADHD, there's this, there's that. And I was kind of like, good Lord, 40 years is a long time to wait. I would have liked to know sooner. Let's try to maybe give a wider lens as to what the sequence of care might be.
Exactly, and not every doctor out there is going to be super familiar with the psychiatry side of things, right? Everyone's built differently, have their own interests, and so some people are definitely lacking in that area, and that's where tools like HiBoop come into play. And so what kind of assessments can people expect in there? What's even on the menu?
Yeah, there's a good 50 assessments there. They're mostly DSM, but there's also some additional scales that we use based on what our customers want. So we add in, there's a good 55 of them. I can't list them off right now, but then we layer in, quality of life, and we allow the provider to even just create their own non-DSM questionnaires to check in. Did you get that job back? Whatever it might be, to layer in all of that data to either course correct and be like, there's not a lot of progress here, and then equally celebrate the success. Or
Attracting top healthcare talent is crucial for providing exceptional patient care, but connecting with the right professionals can be time-consuming and complex. Cherry Health bridges the gap. Our network allows you to showcase your organization, post jobs with precision and ease, and directly engage with healthcare providers actively searching for roles like yours. Whether you're an ambitious do-it-yourselfer or a seasoned recruiter, our intuitive web platform makes it easy to showcase your open roles and organize your applicants. Need a more personalized approach? Cherry Health Staffing Solutions offers dedicated recruiters to find and vet the perfect candidates for your specific needs. Build your dream team with Cherry Health. Visit www.cherry.health and start growing your team today.
And then what is the patient experience like? Like, let's say, okay, we have 40-year-old Steve. He's been struggling with mental health for several years. Doctor wants to get him plugged in on the clinic's HiBoop assessment system. What actually shows up for Steve in his inbox?
we start with whatever pre-screen that the provider wants. They use different ones, different scales. And then what makes this unique, at least from a platform perspective, is that the individual does not know, like they're like, you're in the anxiety test, so they don't actually know what module or which scale they're in. And then we start to flag those, but they don't know, so it's very simple. And then if we want to look further, we give them the opportunity to like pause, you got to go get groceries or whatever it is, and then continue the test, because in some cases there's going to be more questions.
And how long does it take for patients to actually work through the assessments?
They can do it in 15 minutes, but again, if there's more questions or more areas that we want to look into present to the doctor, then there might be more. But that's the initial one. And then once we zone into something that is potentially diagnosable, then we tailor all that in for the check-ins. Now, there could be more that's added, but we're going to check 3 weeks down the road and see if these symptoms or whatever it might be are improving or flatlined or
It's a great way to assess response to therapy. How are things going? Doing these more regular checkups. And those, once you're down the road and you're just doing the follow-up check-ins with a limited subset of questionnaires, it's probably only, a minute or two, couple minutes at a time. Very quick and easy for the patients. And then walk me through the provider side. How do they actually use the HiBoop platform to get their patients to fill out the assessments? You mentioned there's a provider mode where they're kind of driving, and as you probably would normally go through an assessment, but then they're clicking and filling in. If they want their patients to be doing like the at-home or the take-home assessments, how do they get that set up? How do they actually get their patients plugged into their system?
onboarding. So coming in to a new clinic, we certainly have like a great team that helps answer questions, helps onboard. But once that's all set up, it's kind of co-branded. So if it was Cherry Health, then we like try to make sure that we're reflecting who we are, so they're not like, what is this HiBoop thing? But it's relative once it's going, which doesn't really take as long as a lot of organizations. It could be a few days, but then you're off and running.
Okay, wicked. So setup's pretty quick, and then they're off to the races.
It's as simple as just adding like a new patient and selecting the program, and then they'll get an email or a notification of some sort. And then what we do is we'll nudge them if they haven't completed it. So we know that this is the set date, whatever it might be, and maybe they opened it, maybe they didn't finish it. So we just nudge them and say a little bit more to do here to get to that point of, it's already filled out. The preliminary assessment is done before you walk into that office.
Okay, perfect. And then where does the data that's actually collected from the patients go? That stays in the HiBoop platform, or is this plugging into like your EMR or some other database now?
It sits with HiBoop. just
Okay.
based on data security. There's ways that you can export or create a PDF that goes into some EMR or something like that. But we're open to integrate with those systems.
And then so patient, they get various modes of engagement, whether it's a SMS nudge or email, then they're prompted to follow through on these things. That gets sent, then that lands now in the clinician's inbox. You have the whole database there. What can they do with that data as far as analytics or research or follow up with their own just individual patients?
Well, they get like a lot of data in a like they can drill in, they can go deeper and deeper into their own data or the progress of the individual. Reporting is a huge thing, especially if you're going to get grants or funding. It's often like a spreadsheet. So what we do is give like a really presented report that they can use for their boards, they can use for whatever it might be.
And then do the patients have access to that data? Can they see how their mental health scores have been evolving over months or years? Do you think there's much utility or value in that for the patients?
Yeah, it's up to the provider as to when they can, or if they automatically share their progress. So the individual can just go back to that link, assuming that it's been released, because some of these things we don't necessarily want to release right away. But they can go in and track their progress in the same way with slightly more summarized information than that the doctor has. So they can see it.
And do they even need to make an account or log in or anything? Or is it just click the link and then away they go when they get it?
It's just a link.
Okay, perfect. And then, yeah, last time we spoke, like things were like you guys were in the initial launch for the testing period. What was the results? What kind of like feedback did you get? How did the rollout go?
Good. I mean, we got a lot of feedback. So we worked with doctors, there's psychotherapists, there's clinics. So, I mean, we've got some of the biggest, certainly in Canada, clinics using us now. And they continue to provide feedback as to what's next. So we put them in the driver's seat.
Yeah, you guys must have been busy, like just looking at the website, looking at the platform. Like it looks like it's come a long way. Not that it didn't look impressive before, but it's a fancy looking platform now.
It's come a long way. It's come a long way after a solid year of development from our team and also branding.
Yeah, well, congratulations. It looks like it's been quite successful. So I'm excited to see what the next couple years here holds.
Yeah, I'll see you in a year.
If somebody's looking to get a hold of you guys, how can they find out more about HiBoop?
They can find us on our website. So it's hiboop.com.
Perfect. Okay, awesome. Well, Jason, thank you so much for joining us today. Really appreciate taking the time and catching up. It's great to see the progress.
Absolutely. Thank you so much, Jordan.